Hi, my name is Victoria Zangrillo, and today I will be presenting my Bio 4970 grant proposal. And so today we will be talking about the effects of cancer on infertility, a qualitative study. Okay, so the effects of cancer on infertility, a qualitative study. So first we have the rate of cancer in New Jersey. This is a picture just stating the amount of people in New Jersey that have had cancer between 2015 and 2019, and the rate is between 488.9 out of 100,000 per person. And this was all based out of the New Jersey State Cancer Registry data file from June 29th, 2022. And this just gives a little bit of background on the rate of cancer in New Jersey and the effects that it has on many of us. This next picture shows the different reasons for why infertility can be an issue. So there are multiple reasons that infertility can occur. Some are unexplained. There are male infertility, female infertility, if you're a single parent, if you happen to be with a same-sex partner, and laterogenic infertility, which is due to medical treatments, procedures, anything like that, for some reason that a surgery has been undergone and an issue occurred or something was obstructed. And then it just talks a little bit about how each male factor, female factor, and for the either partner could be affected from one of these areas for infertility. So from the previous research done, the first one I looked into was cancer treatment specifically. And for the first study that I came upon, it was researched. What was being researched was the reproductive disorders and establishments of information on oncofertility to adolescents and young adult females. The participants that were involved were 167 females aged between 15 and 39. Some were healthy and others were cancer survivors. They were looking between two to see how this would affect their infertility and them being aware of their fertility status and their reproductive health. The length of the study was throughout 6 months, where questionnaires were distributed to gather a bunch of data. And the results from that were that 41.4% were concerned about the reproductive function and infertility. 36.2% of them were aware of their menstrual cycle abnormalities, which could be a sign of infertility, but not always. 21.2% suffered infertility due to chemotherapy or radiotherapy, which is a certain treatment that you do undergo for certain cancers. And 55.8% of them had only received info on fertility preservation methods, which is a high number that only received information, but not necessarily all the information they need. And that could also be more into health reproduction and just their overall body and knowledge. The next research study that I focused in on was breast cancer, and this study focused on ovarian function and fertility preservation. And the participants that were involved were 131 premenopausal women between the ages of 18 and 45. And the results showed that 93.1% were concerned about the risk of chemotherapy on premature ovarian insufficiency or infertility. 91.6% of them went through GnRHA during chemotherapy for ovarian function preservation. And 12% wanted to try cryopreservation strategies for fertility preservation. And all of these either speak on chemotherapy that had been undergone for the cancer, and the others were to still be able to have children after the cancer was treated. So they preserved their eggs, their sperm, to then later try and get pregnant after. And the last research study that I really got into was cervical cancer. And for this study, the treatment was for abdominal radial tracheotomy for cervical cancer and obstruction and reproductive outcomes on patients. The participants involved were 360 female patients that underwent abdominal radial tracheotomy. And the length of the study was data that was collected throughout 14 years to get a well-rounded amount of people within the study. And the results showed that 26 patients achieved at least 30 pregnancies. 86 of the patients had infertility problems, and 44 patients tried reproductive assistive technology, which again is like cryotherapy preservation. And the most common reasons for infertility were cervical stenosis and fallopian tube obstruction. So those are different kinds of surgeries that patients might undergo to help with cervical cancer or to relieve cervical cancer out of their body. And some variables of this study that I would be doing is the independent variables would be cancer in patients. The dependent variable, is patients with cancer that are infertile. And the covariant factors would be treatment, age, and the type of cancer that person has. And so the execution that I took for my study was that the length of the study was going to be 2 weeks in total, and participants would be used for 5 days to collect the data that I needed to then observe it all and collect it all. And the participants there would be 50 of them that would be used in this study, both men and women between the ages of 25 and 40. 25 and 40 just because that is a good age younger for a lot of people to try and have kids, as well as when you get later in life it could be harder and cancer can affect anyone, so it's good to just have a wide range to look from. And then a general questionnaire would be handed out to each of those patients to see just their general health study, whether they had previous information on their reproductive system and general health, whether they had cancer or not, and whether they were diagnosed as infertile or not. And for the overall study, after that, a blood sample would be taken for both men and women, and then a semen sample would be taken just from men. An ultrasound would be taken just for women, and all of this would test for different hormones, semen defect, and irregularities in the fallopian tubes or ovaries. And all of these can contribute to infertility, as well as the cancer treatments and any surgeries undergone from cancer. And now for my budget. They had overall expenses as my research assistant, my oncologist, my phlebotomist, and my ultrasound technician who would be taking part in this study. And then a couple other equipment that would be used for taking blood, taking the semen, taking the ultrasounds, and then studying each of those and properly handling all materials needed. And accommodations would be given to the participants for traveling as in gas. And for the conclusions and the gaps in the research, I found out that the risks associated with cancer treatments and infertility are two very common things, and the importance of reproductive health is not readily available to young adult patients, and it should be more of a concern and more of a topic to be explained whether a person has cancer or not. It should just be overall spoken about in a daily living health, so that when cancer does come up, or if it comes up, the person that has it knows how to progress on to the next steps, whether that's getting a surgery and never being able to have children, whether it's preserving their eggs, whether it's having somebody else carry their child, and those are important things to think about. And the gaps within this research are that there are a lot of different kinds of cancers and a lot of different ways a man or woman could be infertile. And we don't know which exact cancers make a person infertile or fertile. And just how cervical cancer, a surgery might be done, which makes you infertile, but breast cancer, you might not have to have a surgery done and you might not need chemotherapy and you will be fertile and be able to have children. But you might also have breast cancer and need chemotherapy, which then makes you infertile. It's a lot of different areas that need to be looked at and need to be researched. And another would be that there is still no clear cause and effect of what cancer really does to the body and then how that makes that body infertile. There's still not a lot of different questions to go about that. And then these are the references that I used within my PowerPoint today and then could be further found in my research paper. Thank you for your time.